In the year leading up to 2019, there were 0 cases of measles in those years. In 2019 proper, though, there were over 5,000 cases and 83 deaths. So do you recognize how perpetuating vaccine skepticism or especially propping up anti-vax influencers can lead to such devastating health consequences?
No, the best evidence, first of all, I had nothing to do with the drop-off in vaccination rates in Samoa.
Well, there was the AP did an interview.
In this video, RFK Jr. melts down after Tyler Cohen exposes his insane delusions. So Brian just basically pulls 0 punches here while pressing RFK Jr. on one of the most catastrophic health crises in the recent years, the deadly 2019 measles outbreak in Samoa. With over 5,000 infections and 83 deaths, Brian just raises the real and honestly pretty terrifying consequences of spreading anti-vax rhetoric. And right off the gate, RFK Jr. just goes full deflection mode, denying responsibility despite what public health officials directly told the Associated Press. What makes this even wilder is how quickly RFK just jumps to blaming defective machines. And instead of engaging with the core issue, he just immediately distances himself from the drop in vaccination rates and claims he had no role in influencing the public perception, completely sidestepping the impact of his own rhetoric. Brian keeps the pressure on though, and it's clear from the jump that this clash isn't just about facts, it's about accountability. So make sure to watch till the end to see how RFK Jr. melts down after Tyler Cohen exposes his insane delusions.
Let me just
say the AP did interview folks who were working on the Samoan measles response, and they said that the credibility that you gave to the anti-vax population, the anti-vax forces, did have an impact. Well, those were people who were in Samoa.
But there's plenty of data on the drop-off. The vaccine was banned before I went to the country. So the drop-off that you saw did not change between the time I left the country and the time of the measles epidemic. So that's one thing. The other thing is that the deaths that occurred, the best evidence shows that the deaths that occurred from measles that year were a result of a defective vaccination. The people who died were people who got the vaccine while they had measles, which you should never do. In Tonga, which is next door, which also had a measles outbreak and where they were not given the vaccine, there were no deaths. Oh, of course, the vaccine cartel and the public health cartel that likes to propagandize on this issue points to this and say, oh, the deaths occurred because lowered vaccination rate. But there is no data that shows that. There's no paper that shows that. There's no science that shows that. There's just propaganda. And the best science indicates that the actual reasons for those deaths in Samoa were a defective vaccine that was brought in from Australia and was pulled when the public health authorities realized that it was killing people.
But that's not what the evidence says. The evidence says that it was the evidence says that it was actually 2 vaccines that were mixed with an expired muscle relaxant.
You know what? No, that is propaganda. That is propaganda. And there was a series of deaths that occurred from vaccines, from the MMR vaccine prior to that, and a series of injuries, including in the prime minister's own family. And that's why he made the decision long before I went to Samoa to ban the MMR vaccine in Samoa.
So this is where RFK Jr. just starts unraveling in real time. Brian brings up the AP's interviews with health officials who were literally working with the measles outbreak in Samoa. These are people who flat out said that RFK Jr. gave credibility to anti-vax forces and that influence mattered. Like, this isn't just some vague theory. It's what the folks on the ground actually said. And instead of addressing that, RFK just launches into this mess of excuses and conspiracy rhetoric. And then he just starts talking about how the vaccine was defective, blaming a muscle relaxant in the mixture, and acting like that's the reason for all the deaths. But here's the thing. Yeah, 2 babies tragically died due to a nurse's error mixing the MMR vaccine with expired anesthetic. That part is true. But what RFK is doing is just exploiting that incident to downplay his own role in spreading vaccine fear. He just keeps insisting that there's no science showing low vaccination rates led to the outbreak. Except, there absolutely is. In 2019, after the tragedy, Samoa's MMR vaccination rate plummeted from 74 to just 31%. That was the lowest in the world. And surprise, the very next year, the country had over 5,600 measles cases. most of them being children. That's not propaganda. That's what happens when vaccination rates crater. But instead of acknowledging how misinformation, including his own, made things worse, RFK literally tries to spin it as some shadowy plot by the vaccine cartel and public health cartel. Like, bro, come on.
Donald Trump has come out and said that he wouldn't fund schools that mandated certain vaccines. Do you agree with that decision?
Yeah, I do. I want to speak to everybody, including people who don't agree with me on issues. I want to say this. My vaccination policy will not take away vaccines from anybody who wants access to them. My only issue is they should not be mandated. I don't think any medical intervention should be mandated. And let me just say this. Right now, the CDC is recommending the 9th COVID booster. Oh, that's their recommendation. 90% of Americans have made a decision not to take it. Do you think that the federal government should do what they did with the first booster, which is to tell people, okay, you can't work, you can't travel, you can't get on an airplane, you can't go to your job unless you do what CDC says? So I don't think that most Americans want that. What I want is good testing, good safety testing for vaccines, good efficacy testing, so that everybody can make informed consent about whether they want this product or not, whether it's good for their age group, whether it's good for their cohort, whether it's good for them. And let's do the same kind of safety testing that we require for other drugs. And we don't do that for vaccines. Vaccines are exempt. The only medical product that's exempt from pre-licensing safety studies. And of the 72 vaccines now mandated for our children, not one of them has ever been tested in a pre-licensing safety study. That's just wrong. We know people get injured, and that's who I'm concerned with. If you're fine with it, if you've gotten a good result, you should be able to get it. We ought to be not telling people when they're injured that it didn't happen and gaslighting them and punishing doctors who report injuries. We should be doing good science, and we should be supporting people who actually get injured by these products.
I think I don't have the numbers right in front of me, but the numbers are pretty clear in terms of the efficacy and the safety of this COVID vaccine, and it was used on the biggest on the largest scale of any vaccine in America in the history of the world, and again those numbers are pretty clear in terms of the efficacy of this vaccine in terms of the number of hospitalizations and deaths for people who didn't get the vaccine versus those who did get the vaccine.
Okay, Brian, you know what? You're talking about data that does not exist. And I'll just tell you a couple of things. Our country had the worst body count from COVID of any country in the world and one of the most aggressive vaccination schedules. We had 60%.
I would also say that we had the Republican president who was not exactly advocating for vaccinations or even taking the virus itself seriously. I mean, Donald Trump was downplaying the severity of the virus, but it became politicized.
Now you're talking crazy talk, but let me just finish this.
It became completely politicized, and there was a clear delineation.
President Trump brags about the vaccine as the miracle of his administration, the Operation Warp Speed, the greatest accomplishment of his administration.
So RFK Jr. just goes from casually backing Trump's plan to defund schools that require vaccines to claiming there's no proof COVID vaccines help reduce hospitalizations or deaths. Meanwhile, Brian's just trying to keep things grounded, pointing out how the COVID vaccine rollouts was one of the biggest public health efforts in US history, and that the benefits were so obvious to anyone actually paying attention. Then RFK throws out this idea that vaccines are the only medical product exempt from safety testing, which just isn't true. Vaccines go through layers of review and oversight, but he acts like it's some lawless Wild West. And the way he spins it into all this personal freedom issue, like no one should ever be required to get vaccinated, even in the middle of a public health emergency. He even tries to use the fact that most people didn't get a 9th booster as proof that the public rejected science, when really most people had some immunity or just weren't in a high-risk group anymore. And when Brian pushes back with basic reality, that unvaccinated folks were clearly getting hit harder, RFK just shrugs it off and says that the data doesn't exist. It's not even a debate at this point. It's just straight up denial.
So he wasn't hostile to the vaccine. He was doing whatever Anthony Fauci
There was a clear partisan divide in terms of people who would take the vaccine. But I'll let you go. Go ahead.
Let's just talk about data. We had 16% of the COVID deaths in our country. We only had 4.2% of the world's population. So why isn't somebody explaining to us why we had the highest death rate in the world? We were told that Haiti and Nigeria were going to get wiped out from COVID. Haiti had a 1%, 1.3% vaccination rate. It had a death rate from COVID, 1/200th of our death rate. Nigeria had a 1.4% vaccination rate. It had a death rate from COVID of 14 per thousand per million population. We had a death rate of 3,000 per million population. So there's no correlation between vaccination and death counts. In fact, the best studies, like the Cleveland Clinic study, which is 56,000 patients, one of the biggest studies, shows that people who got vaccinated were more likely to get COVID. There is no study that shows that COVID had a beneficial impact on deaths. I know that you're told that. This is orthodoxy, but the studies just simply don't exist. And the clinical trial study is never measured for that. In fact, Pfizer's clinical study, which is the one that is made public, showed that people in the placebo group were 23% less likely to die than people in the vaccine group. So if you got vaccinated, you're 23% more likely to die of all causes over the next 6 months, with a 500% increase in cardiac arrest. We're now seeing a whole generation of kids who are dying from cardiac arrest on the playing fields. We're seeing athletes drop dead on the playing fields at rates we've never seen in history, and nobody is explaining that. And the press, the liberal media, is not asking the questions, was that person vaccinated, and does this? We're seeing 2 of the 4 vaccines have now been pulled because of pericarditis, myocarditis, thrombocytopenia, which is blood clots. We're seeing larger excess deaths last year after vaccination with no COVID than during the height of COVID. So nobody can explain this, but what you were saying about a decline in deaths simply because of the vaccination, that data simply do not exist.
Well, I would disagree with that, but I'm also not a doctor.
Show me the data. Show me the data. Show me the study that you're relying on.
I do have to ask, is it your position then that the politicization of the virus, of the vaccine, had zero impact on survival rates in the aftermath of COVID? Because there was a clear delineation. There was a clear delineation between Fox News watchers, for example, who had higher death rates than those who were not watching Fox News, who were not consuming right-wing media, who had higher survival rates.
Well, I wouldn't say that the highest death rates in this country was in New York, which is a blue state.
Right, but that was in the beginning before there was a vaccine. At the end of the pandemic, it was actually in Florida, led by Ron DeSantis, who is, of course, a major opponent of any vaccines.
Well, Florida would have you would expect Florida to have the highest death rate. I'm not sure that it did. I know that Florida outperformed California, and they're roughly equivalent in size, but Florida has a much older population, and those were people who would die from COVID. So I think what you're saying about red state or blue state, that there is no study that, there are lots of other, there's more obesity in red states, there's more elderly people in Florida, so there are a lot of covariables.
You don't think politics played any role in the acceptance or refusal of vaccines in the aftermath of COVID?
I do, but I don't think vaccines had a benefit. I don't think there's any data that show that the vaccines had a beneficial impact on the reduction of COVID or survivability of the COVID. I'd love to see the study if you can show it to me.
So yeah, as you can see here, RFK Jr. just keeps dodging the core issue. Brian lays out the basic math. America had a tiny fraction of the world's population, but one of the highest COVID death rates. And instead of engaging with that, RFK just pivots to cherry-picking examples like Haiti and Nigeria, ignoring all the context like healthcare access, testing, reporting standards, just to suggest vaccines made no difference. It's not even a good faith argument at this point. Then Brian shifts the conversation to media influence, like how right-wing outlets fostered vaccination skepticism that quite literally costed lives. But again, RFK just won't go there. He tosses out distractions about New York, Florida, red states, obesity, anything but addressing how politicized narratives shaped who lived and who didn't. And even when he admits that politics mattered, He just refused to reckon with how biased messaging steered people away from life-saving decisions. And that's the real issue here. It's not just about bad info, it's about how bias dressed up as skepticism kept people from trusting reality. And speaking of bias, are you getting tired of getting news from biased news sources? One outlet says one thing and another says the complete opposite? How are you supposed to know what's actually true? That's where ground news comes in. It lets you compare how different media outlets, whether it's left, right, or center, are covering the same story. So you can see the full picture instead of just the echo chamber. And here's the best part. Click the link in the description and get a 40% off the Vantage tier, which gives you even deeper insights in media bias and political trends. So stay informed, think for yourself, and check out ground news in the description down below.